My name is Robin Kibler. I am an RN who has worked in the Pediatric Intensive Care Unit for 24 years and have experience in caring for non-accidental trauma, also known as child abuse. I am also a neonatal pediatric transport nurse responsible for picking up neonates and pediatric patients from other hospitals. We have special training in assessment and hands-on skills. Child abuse is defined as physical and psychological harm to or neglect of a child by another person, whether child or adult. Child abuse is more common than we like to think. It is important for parents to recognize the actual risk and familiarize yourself with the signs of abuse. More than 2.5 million child abuse cases are reported each year. Of these, 35% involve physical abuse, 15% involve sexual abuse, and 50% involve neglect. Studies show that 1 in 4 girls and 1 in 8 boys will be sexually abused before they are 18 years old. About 1 in 20 children are physically abused each year. Most child abuse occurs within the family and often by parents or relatives who themselves were abused as children. They don't know how to discipline their own child in a healthy way. Neglect and mistreatment of children is also more common in families living in poverty and among parents who are teenagers. They are struggling with the maturity and the patience it takes to be a good parent. Alcohol and drug abuse is a risk factor that pervades all social and economic classes. Even though abuse by family members is most common, abusers can be anyone the child has contact with, including family, friends, babysitters, teachers, clergy, and daycare workers. Although there has been a recent increase in child abuse outside the home, it is still true that most often children are abused by a caregiver or someone they know, not a stranger. Education should include parenting classes, stress and anger management, and drug and alcohol rehab. We also need to teach children that abuse is not okay and that no one should ever touch them inappropriately. They should not be afraid to tell, and they should never feel like it is their fault. Physical abuse involves injuring a child's body and usually affects children 3 years and younger. This could include bruising, cuts, burns, bone injury, head injury, or injury to an internal organ. Shaken baby syndrome is frequently seen in infants 3 to 8 months of age. The caregiver becomes frustrated with the infant crying and shakes them back and forth to make them stop. This causes the blood vessels in the head to rupture and nerves and brain tissue to tear, resulting in swelling of the brain. The outcome is usually poor and may result in death. Physically abused children may avoid being touched or be afraid to go home. Emotional abuse doesn't leave physical scars and may be harder to prove. These children are usually shy and afraid of doing something wrong. They are constantly blamed, yelled at, terrorized, isolated, and shamed in public and private. The caregiver usually acts one way in public and differently in private. Sexual abuse is any sexual activity that a child cannot comprehend or consent to. It includes acts such as fondling, oral genitalia contact, genital and oral intercourse, as well as exhibitionism, voyeurism, and exposure to pornography. The abuser may be unusually controlling, trying to limit any contact with other children or adults. In recent years, the Internet has become a popular conduit for predators seeking children for sexual abuse. Child neglect is the most frequent form of abuse. It can include physical neglect, withholding food, shelter, clothing, or other physical necessities, emotional neglect, withholding love, comfort, or affection, or medical neglect, withholding needed medical care. Neglect is not always intentional. Caregivers may become disabled physically or mentally, or drug and alcohol addiction may impair their judgment. These children may appear to be unsupervised, running the streets, absent or late to school, have disruptive behavior, or be socially withdrawn. Physically, they are dirty and unkept. Clothing is inappropriate for the weather, dirty, and doesn't fit. Their caregivers may seem unconcerned and are never at home. Munchausen by proxy syndrome is uncommon and difficult to prove. It was named after an 18th century German dignitary, Baron von Munchausen, known for telling outlandish stories. Munchausen by proxy, usually the mother, lies about symptoms or deliberately makes her child sick. She may exaggerate, make up, or induce symptoms. When hidden cameras were placed in hospital rooms and ERs, the parent would be observed smothering the child, switching the medicine, injecting the child with urine to cause an infection, and contaminating wounds so they would not heal. These symptoms usually disappeared when the child was separated from the parent. The long-term prognosis depends on the severity of damage and the amount of time it takes to recognize and diagnose. There are different theories as to why parents would do this to their child. Some think that the caregivers were abused as children, physically or sexually themselves, or the caregivers come from families in which being sick was a way to be loved, and some feel that it is a cry for help. President Bush named April National Child Abuse Prevention Month. During this time, there are programs, rallies, and speeches to make the public aware of how serious a problem it is. If you ever suspect any form of child abuse, it is your duty to report it. If it is reported early enough to get help for the child and the parent, you can stop this vicious circle and make a difference in their lives. You can report child abuse by calling 1-800-4-A-CHILD, and you can do this anonymously. Thank you.